Researchers are looking at the CDC's suicide data from the last 2 years. ABC's M. Wynn reports on the findings, which tell us more about which groups are at a higher risk and when suicide cases spiked.
Suicide is the 10th leading cause of death in the United States, but it hasn't always been clear who is most at risk for suicide, and for intentional drug overdose in particular. Researchers from the National Institute on Drug Abuse analyzed CDC data from the last 2 decades on intentional drug overdoses. They found that intentional drug overdoses have gone down overall, but they've gone up among people in certain groups, including young people, Black women, and elderly people. They also noted a relationship with time. The cases spiked on Mondays and fell on weekends. They also fell in December and went up in the spring and summer. If you have had thoughts about hurting yourself or are worried about someone you know, you can call the National Suicide Prevention Lifeline at 1-800-273-TALK. With this Medical Minute, I'm Em Wynn.
And if you or someone you know is thinking about suicide, contact the number 808-832-3100 for Oahu residents or 1-800-753-6879 for Neighbor Island residents. There's also a local crisis text line. The number for that is 741-741.